Hi, this is Erica Walda, and this is my submission for our personal strengths assessment assignment. After reviewing the characteristics this week, I did choose to score myself with self care as my greatest challenge, organization as my middle, and my greatest strength being advocacy. So, the way I rated self care the way I did is because I'll be very honest. Sometimes I struggle with not getting wrapped up in stuff and taking time for myself. And then I experience almost like a burnout, right? Where I stop and I'm like, okay, I probably should have maybe taken a day for myself, or, I've just taken on too much to really just continue going. And I do experience that. So, for healthcare professionals, I really think that, it's super important. It's going to help them prevent burnout by having that self care. They take on so much from every one of their patients, from their nurses, from their staff. It's really important for them to have those healthy outlets to make sure that they don't experience that burnout and that they have that time for themselves. A plan to develop self care further for myself, honestly, is something that's ongoing. One thing that I have kind of learned about myself is I look ahead at the beginning of every month and I may schedule 1 or 2 PTO days for myself from work. I do work full time as well as go to school. I have 2 small children, so it can be extremely busy a lot of the times. Really just making time for myself, whether that be just taking time to go grocery shopping by myself, or maybe going to get a massage, just really anything that's going to help me take my mind off of everything else I'm doing for everyone else and be able to have less of that burnout feeling. I think that would help me you know move forward professionally with my progress going forward. It may sound silly, but something that I do weekly is, I may block off time for a lunch break, or even just time to take a 15-minute break to stretch or just get up from my chair, or something like that. That right there, I think, also qualifies as self-care. I think that's really important to make sure you do have time to kind of step up and get away from your desk and get a glass of water, or just something simple where you're not just go 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 to everyone else. Number 5, organization. Something about me is I am actually really great at organization. I'm great at creating lists and making sure that I have everything organized for what I need to do each week. However, where I fail is the consistency. For me, a lot of times maybe I'll say, hey, on Mondays, I'm going to make sure that, I do X, Y, and Z. Well, maybe with my day, it gets very busy. Maybe I'm only able to complete X and Y. I struggle figuring out where I'm going to take Z that I didn't get accomplished and putting it back into my schedule so I don't fall behind. So I think for me, a way to develop a plan to continue getting better at organization would be really just keeping track of what I fall off on. So maybe that's, maybe creating a smaller list where the things that I didn't get accomplished. And then maybe making a day where I don't have scheduled tasks where I can do those things that maybe fell off because I did run out of time. Having a little bit more grace for myself, because I think honestly, a lot of times I think we kind of get wrapped up in this like stigma really of having to get everything done. But sometimes that doesn't work. So I think having grace and really just staying consistent with organization, I think that's really going to help me, moving forward in the future. As far as healthcare professionals, organization is huge. I can't imagine a doctor's office or a physician or a mental health provider not having a schedule. Just imagine them just taking patients coming in and out of their office every day, but no real schedule, no schedule for their staff, for their lunch breaks. That would just be so much chaos. So, as a healthcare professional, organization is probably going to be one of their better, I would say, characteristics, because it's something they do have to put first every single day for them. Um, let's see. For number 10, for my greatest strength, I actually chose advocacy. Myself, I actually manage a medical billing group for a specific hospital and multiple clinics out west. So, I am always listening and really just kind of fighting that good fight for those patients. Lots of times when they call in, they're probably going to talk to two or three people before they get a hold of me and they're transferred to me. So when I do take those patients' calls, you can imagine they're pretty upset. They've had to repeat themselves. The biggest thing is listening, active listening. Um, every single person that I come in contact with through my job, in that sense, is really just looking for someone to physically just stop and listen, hear them out, not just give them blanket statements of what should happen or what the answer may be, because sometimes there are mistakes made. So, really taking that and just letting them know, like, yeah, I know our answer is this example. However, I'm willing to reach out further and make sure that we do have everything prior and up to that answer correct to make sure there wasn't something missed, like they're saying. So, advocating for the patients and actually listening, that right there is going to resolve a lot of those biggest concerns. As far as healthcare providers, honestly, they have so many resources. When they're active listening, they're able to offer their advice and offer those specific resources to really try to help those underlying issues. So, hypothetically, maybe maybe the patient or someone comes in and they have concerns about headaches and things of that nature. However, that active listening as a healthcare professional, they may take the time to specifically stop and say, okay, what's causing these headaches? And then you may find out maybe the patient lost their job last week, right? So stress is causing their headaches. So offering your expertise and that guidance for maybe ways they can help reduce stress. And that would also kind of go hand in hand with self care sometimes. So I think having those resources as a healthcare professional and having that very active listening, it's going to be a great way to really advocate for your patients and make sure they have everything that they need specifically. For me, I would say a good plan to continue making sure the advocacy is one of my greatest strengths is really continuing just having the active listening. Even if it's something that's not maybe in my wheelhouse and expertise, maybe just still listening and offering and asking additional questions so maybe that we together can come up with a better solution or maybe see if there's something else underlining to make sure that they have help. Or honestly, the best thing I think would be to do is, maybe it's not in my wheelhouse of expertise, but maybe that I know someone that can help more beneficially in this situation and maybe bringing them together to help with situations like that. Thank you so much.